Good evening and welcome to another edition of Eyewitness News Close-Up. My guest tonight is Dr. Thomas Abderholden. Hopefully I pronounced your name right.
You did. That's very good. Thank you. Yes.
And Dr. Thomas Abderholden is from the Alexander Diven Falk Cancer Center at Arnold Ogden Hospital. Thank you for stopping by tonight.
Glad to be here.
And we're going to talk about cancer, and also we're going to talk about the center, which is new.
Right.
What prompted that center?
Well, what prompted the center is, which isn't in existence yet, but is being planned. I meet weekly with architects to get it started, but what started that is because of the need in this community to develop a single site in the area for cancer community treatment, so that patients can receive the very good treatment that is available in this town and community already into one location in one area. The center will house the radiation therapy units presently at the Arnold Ogden Hospital, but will be moved to the center. There'll be myself and other medical oncologists. There'll be oncology nurses who take care of giving the treatments. There'll be other support services, including pastoral care and dietary care and other needs and services of patients so they can receive the best care available in the area for their cancer treatment.
Now, is this the first center of its kind for this area? Or
it's the first center of this kind in the area. It's the only one in the area that's being planned. It's been a dream of mine for some time to have this come about, and it's very good to see it. So it's something that the nearest location presently is in Rochester.
Rochester, the nearest.
So that's all for patients, a much closer area to get their treatment rather than traveling quite a distance.
So since Rochester is the nearest, I guess common sense will tell you that there's a need for a center like this in this area.
That's correct, yes.
What about the technology for cancer? How advanced are we today with that compared to 20, 30 years ago or 40 years ago?
Well, it's also progressed. As medicine has progressed, so has the development of detection of cancer as well as treatment of cancer. With not modern-day X-ray equipment and mammography, which is an X-ray of the breast, cancer that is the size of a dime can now be found on a breast cancer X-ray that could previously not be felt or seen until it became of a significant size, so that it would be very far advanced. So by detecting these cancers very, very early, we can treat them very, very early and have a much better chance of long-term survival and cure for the patients.
Life expectancy is probably higher than it was 20, 30 years ago.
Oh, absolutely, absolutely. There's many, many advances in cancer that we've made that before cancer was uniformly a death sentence. When you had the name cancer, you just automatically assumed you're going to die in a matter of 3 to 6 months and forget it. But now with modern treatments, many patients, although they're not all cured of their disease, are living significantly longer, and many are cured and able to live normal, useful, productive lives.
You find a lot of people fearing when they have cancer, the chemotherapy. Is that still used, or are you leaning away from that today? Or?
Well, chemotherapy is what I do mostly in my practice as a medical oncologist, and some of the drugs that we do use do cause a fair amount of side effects: nausea, vomiting, hair loss, diarrhea, other sort of discomforting ailments. But there's also some drugs that do not cause those kind of symptoms, yet are very, very effective in treatment. The big thing is nowadays is to make the patient comfortable while they're taking their treatments. And many of these drugs that I mentioned that do cause significant side effects, nausea and vomiting is the one that most people are most unappreciative of. The symptoms can be markedly alleviated with other techniques and other medications, so the patients really are not sick even though they're taking the same medications.
So besides chemotherapy, there's other therapy or other treatments for it?
Right. There's also certainly surgery is a very important role to cut out the tumor if you possibly can. If that's not possible, then one goes to chemotherapy, which is what I do. And the third main choice is the use of radiation treatments or X-ray treatments to get rid of cancer cells.
I like to ask questions that people were thinking about at home. How do you prepare somebody for, to say, well, I have cancer? How do you prepare your patient for something like that?
You prepare them by telling them, being honest with them, above board, explaining what's going on in their terms. I try not to use $1.98 doctor terms to explain things, and by doing so, the patient has a better understanding of what's going on and can therefore assist in their own care of themselves. I try to promote a organized treatment plan. This is what we're going to do, and this is what we hope to accomplish. And above all, to instill hope and encouragement that there's something we can do for them, that they're not going to be put out to pasture and forgotten about, and we'll come and pick up your bones in 3 months or something like that.
And I guess you do the same thing for the family members also.
Right. Cancer or any illness, but cancer in particular, is not a patient disease, it's a family disease. So when the patient gets sick, obviously he has needs and cares and desires that can only be fulfilled by other family members. So the family is a very important, integral part of this team, and usually my first consultation with the patient is usually with the patient and their family to discuss these various matters.
Cancer always strikes the minorities. True or false?
False. Very definitely false. You may read that and you may hear that, but that's very much false. Cancer has no favorites, has no special groups. It attacks everybody anytime at once, it seems like sometimes. Certain groups or certain people may be more susceptible to certain types of cancer, but cancer is found in every ethnic group, every race, every part of the country, every part of the world. It is not a one disease person. It goes everywhere.
What about the advances in breast cancer for women? How advanced are we today with that?
Well, the biggest advancement in breast cancer has been with the detection mechanisms, and I mentioned before mammography, but with breast cancer nowadays, there's a recommendation from the American Cancer Society to have a mammography, a breast X-ray before the age of 35, and then from the age of 50 yearly thereon, and by doing so, we'll decrease the long-term death rate of breast cancer. Breast cancer affects like 1 out of every 11 women in this country on an average basis. But by finding these cancers in a very, very small size, we can find them early before they've had a chance to spread, and therefore have a very good chance of offering cure for these women.
Okay, we're going to talk a little bit more about breast cancer. We'll be back. We're going to take a break, so we'll be back right after this. Second portion of Eyewitness News Close-Up. Tonight, my guest is Dr. Thomas Abderholden. He's from the Alexander Diven Falk Center at Arnold Ogden Hospital, and that center is not available right now, but it's going to be a new center in the near future coming up at Arnold, right?
Correct.
And if they missed the first part of the show, why don't you let them know? Why don't you just let the people know what is that center? What is the center all about?
The center is a area within our community where we can provide very good cancer care, total cancer care for the patient in this area without having to travel to other parts of the country. Rochester being the closest one of its kind in this area. So it's a way to offer comprehensive cancer care for the patient and offer support services for the family and the patient while they're receiving treatment.
Some preventative ways for cancer. We talked about breast cancer. What should the women do out there for the breast cancer?
Breast cancer, the big thing that is proven, and it works very, very well, is to have a mammography, which is a breast X-ray. That should be done before the age of 35 as what's called a baseline to compare it to something later on. And then after the age of 50 on a yearly basis. That's for patients that are of average risk and have no special risk factors like their sibling had breast cancer or other family members. For those people that have had breast cancer in the family, it's recommended that they start at age 40 to find it before it becomes more evident and grow to a point beyond where they can really find it then.
No, do we find colon cancer more in men than women, or?
No, it's an equal opportunity disease, and it is a disease that's also thought to be somewhat dietary related. It is known that in Western societies, the incidence of colon cancer is much higher than those in the third world countries where there's less animal fats and other sort of chemicals like that. Also, in this country, we don't put as much emphasis on bulk in our diet, and in those countries, bulk is very, very important to them. And so it says something about the dietary habits. It's also known when those people move to this country, to Western cultures, and assume the Western diet, their incidence of cancer approaches that of the Western with civilization. So it was something in our diet kind of thing. And so the idea of having bulk in your diet to sort of flush things out, so to speak, and to decrease the amount of animal fats in your diet and red meats makes sense. Doesn't mean you eliminate all those factors because they're very good for you, but moderation is very important. And by cutting back on your diet like that, it's hoped that the incidence will be decreased. Also, with colon cancer, there's a very good screening test for colon cancer, and it's called a hemoccult test, where you go to your doctor, and sometimes they have individual pharmacies have sort of a promotional exercise, but it's a special chemical impregnated card that you place a small amount of your stool on it, and then it is processed by either the physician or somebody else with another chemical, and it detects blood in the stool, blood that you cannot see, not blood like when you wipe yourself you see that, but this is blood that's mixed in with the stool, and you can find colon cancer very early because the leading sign of colon cancer is blood in the stool, and because it is of the lining of the colon, so you can find the blood there and then find it and detect it before it gets very far along and have a very good chance of cure by surgery alone.
Now, this new center, the Alexander Diven Falk Cancer Center at Arnold Ogden Hospital, when will we see that? What's the groundbreak? What's the target date?
Target date is October 1st, 1991. We hope to break ground August 1st, 1990, and construction for about a year after that.
Okay, Dr. Abder Holden.
Right.
Thank you for stopping by and talking to us about cancer. And that's another edition of Eyewitness News Close-Up. Have a good night.